and still talking about health. We know our eyes is our vision to our body entirely, and this morning we are going to look at glaucoma. To do justice to that, with us on our health segment this morning is a consultant ophthalmologist in person of Dr. Aisha Sherrif Kalambe. Dr. Aisha, you're welcome to the program.
Thank you.
Yes.
Good morning.
Yes.
Afternoon, everybody.
Like we say, we know how important our eyes
Yes.
are and what to use our eyes to do, right?
Yeah.
Now we are looking at glaucoma. Talk to us and what we need to know about glaucoma.
Okay, so glaucoma, as we call it, is the silent thief of sight. It's silent in the sense that usually no warnings, there's usually no pain. There are different types of glaucoma, but the commonest ones, particularly in our environment, is the primary open angle type. Okay. Unfortunately, no signs, no warnings, no pains. So by the time you realize you have a problem, it's most likely too late. It's the commonest cause of irreversible blindness worldwide, and Nigeria has been reported to have a very high prevalence of this disease. So awareness about glaucoma and what the disease entails is what we're trying to tackle. To this effect, the second week of March is always World Glaucoma Week. So we're taking this opportunity to tell the public a bit more about the disease condition. It's a damage that occurs to the nerve. The nerve is like the wire, basically, that connects the eye to the brain, to get the information, transmits it to the brain before the brain interprets it in terms of vision. So because it's a nerve tissue, it has no ability to regenerate. So any damage is permanent and it's irreversible. It's a very slowly progressive disease. So the best thing you could do about it is to catch it early. Early.
Like you say, it doesn't give warnings at all. And before you know, you are down with issue of eyesight. Now, how does glaucoma affect our vision?
Okay, so as I said, the nerve is what is affected, the optic nerve. So basically, imagine your vision being like a whole cone, for example. So the field you're seeing is multi-dimensional. So you see on average about 180 on this direction, in this direction. Ideally, when you stretch out your hands, you should be able to see your hands. Okay, even when you're looking straight, you should be able to have some field of vision here and some on this side as well. So the thing about glaucoma is that the sides are what is affected first. So you lose that peripheral vision initially, and then it creeps in slowly over time. The central part is usually the last bit to go. So you can end up having a tunnel vision. Because it's the sides you lose first, and that's why most people don't realize there's a problem, because you might not even take note of that area, and you won't even know that you're unable to see, particularly when you're using both eyes like that, and that's why. So it's the sides vision that you lose first, and then it creeps in gradually until the entire field is lost.
Wow, you see why information is very, very important. Now we are talking about glaucoma, and we've got to know one this morning, that is the sides that we lose first before it comes to the major part of the eye. Now talk to us, what are the causes of glaucoma and the risk factors of glaucoma?
Okay. So unfortunately, like many medical conditions, the cause is not known.
It's not known. That is what they'll tell you.
The cause is not known, but it's a disease that has been linked severally to genetic mutations and genetic abnormalities. So with that in mind, it's an inherited form of disease. So again, like many diseases, there's primary and then there's secondary. So the primary diseases are usually the ones that are inherited, the ones from gene mutations. Again, even in that type, we have different types. Open angle glaucoma, depending, this would be identified when the healthcare professional has checked. So some are open angle, some are closed angle, some are congenital, children are born with it, while some are things that would develop at an early age, so juvenile angle, and then some, the commonest, occurs above the age of 40, so with age. So some are open, as I said, some are closed angle. In our environment, we have more of the open angle type, which is unfortunate, because the closed angle type is usually the one that could give you an early sign. Because these angles are closed, there's pain associated with the condition. So the pain is enough to send some people to the hospital initially. But for us that have open angle more than any other type, pain is not usually a factor there.
Okay.
So inheritance, so these are the primary ones. Then secondary glaucomas are the ones that are as a result of something. So anything that can range from eye diseases, so eye infections, whether the anterior part of the eye or the posterior part of the eye, disease conditions like diabetes predisposed. So those are things that you can call like risk factors. Because we've talked about genetic associations with it, it's been found to be commoner in blacks. We are black, so that's a risk factor.
Yes,
it's commoner in men, so again a risk factor
in men,
which we have as well. So it's been found from several studies, epidemiological studies that have been done, that we have the worst type of glaucoma. Our patients present late, and unfortunately we also have more rapid progression of the diseases. So many negatives.
It's like the problem is a general problem.
Yes, it
tends to present late.
Yes.
And when we get to the hospital, it becomes a major problem.
So imagine it like this, like you have a broom, for example. This is a way to explain it to someone so everybody understands. Because the nerve is like a bunch of several wires. They're like 1.2 million neurons of that optic nerve. So you have a broom with several sticks. So imagine it like that. And each of those sticks is like 1.2 million. When you first get your broom, it's big, it's thick, it's big. You can sweep very comfortably with it. But every time you use it, you might lose a few sticks. Sure. That's not a problem initially because you can still sweep with it. But after a while, the more of the sticks you lose, eventually becomes smaller and smaller and useless. That's exactly what it's like. So you're losing those fibers gradually. Initially, it's not a problem. You can still function. But after a while, by the time you're noticing that you have a problem with glaucoma, almost 80% of the fibers are already gone.
Wow.
You can imagine how bad it is. And always remember, it's not reversible. We can't fix it.
Okay, now that now that you have given us insight into what glaucoma is all about, let's talk about treatment.
Okay. So, as I said, not reversible.
Okay.
So the bottom line and the most important thing to take away is that early detection. Okay, because when you do find it early, before it becomes so dilapidating and debilitating, then you can halt it. Because the aim of treating glaucoma is not to reverse, it's to stop the progression where you find it. So the earlier you find it, then the earlier you can halt the progression. Unfortunately, the only risk factor that is reversible, so we've mentioned them, the age, the race, the gender, and all of those are risk factors. Family history of the diseases, associated conditions like diabetes, hypertension, all predisposed people, and they're all possible risk factors. But the only one we can modify is the intraocular pressure. So the intraocular pressure, so the eye, everybody knows what the eye is. So it's like a sphere, and it contains fluid in it, in the anterior part and the posterior part. So this fluid that is in the eye is continuously being synthesized. So there's a production and there's excretion from the eye itself. So it's like you're having constant production. That's why I'm talking about open angle and closed angle. So those angles are drainage angles, the pathway through which the fluid that is being produced flows out. And that fluid is important because that's where the nutrients come in from, supplies the parts of the eye with the nutrient that it needs. It's produced from the blood itself. So production needs to balance excretion. So if you're producing more than is going out, then it's accumulating and it's building up. Unfortunately, those fibers are now going to be pressed. Like when you tell kids, remove the rubber band from your hand because you're preventing the blood supply from reaching this. So that's exactly like that. So the pressure is compressing on those wires that and the longer it stays, then the longer they're deprived of oxygen and supply and nutrients, and then they die. So the only thing we can modify is medications or treatments to reduce that pressure that is being mounted on the nerve and thereby reducing it. So treatment is either medical therapy, so eye drops, or tablets that we can use to reduce the pressure, or surgery. By surgery we mean creating alternate, as I said, it's like a flow channel, so that channel is compromised, so you're creating an alternate flow pathway. Again, you're just increasing the space for it to leave. You can't really do anything about the production at that. The flow, creating an alternate pathway means that the build-up, because the production is going to continue, so the build-up is reduced. Again, we also have laser therapies that you can use. Again, the laser is just also creating an alternate pathway for it to flow. So medication, surgery, laser therapy are the available treatment modalities, all aimed at reducing the pressure as much as possible.
Okay, Thank you so much for taking out your time to give us this wonderful information, what we need to know about our eyes and what glaucoma entails. Thank you so much for your time with us on the program this morning. Oh, yeah.
All right.
Okay. Yes, we have been speaking with Dr. Aisha Sherrif Kalambe. She is a consultant ophthalmologist, and together we looked at glaucoma, and she has talked to us. Please take care of your eyes, because we know how important our eyes is to our body. Now